All right, well, it's been a month of presidential speeches and some pretty raucous town hall meetings, yet the more that's being said, the less we seem to understand about what the president's health care plan really entails. We may not have to wait until his speech on Wednesday to find out. Maybe we can find out a little something right now. We have somebody with us today who's been helping the Democrats craft that legislation. It's Dr. Kenneth Thorpe, considered by many one of the leading experts out there in the country on health care. Also currently with Emory University. You wear a lot of hats. I couldn't go through them all, but you trust me, the guy knows what he's talking about when it comes to health care, quite frankly. Thank you for being here. I will start with the public option. Is there, in your opinion, as a medical expert, not one side or the other, just as a medical expert, can you have health care reform without a public option?
Well, I think having a public option makes the bill better because it injects competition into the healthcare marketplace. There's a lot of parts of this country there was very, very little competition, and having a public option in there would increase competition in the marketplace. You could do it without a public option.
Okay.
One of the ways to do this would be to go to the source of what's driving the rise in healthcare spending. We know that the doubling of obesity in this country accounts for a third of the growth in healthcare spending. So if we really wanted to target what's going on in terms of healthcare costs, we would target rising rates of obesity, and we do a better job of managing chronic healthcare conditions.
Does it seem like we're not talking enough about that stuff? Because we have more politicians talking about it most times than we hear from doctors sometimes. And as a doctor, if we go to the heart of the problem, it's just to make people healthier.
Yeah, I think if we're going to be serious about controlling the growth in spending, we really have to go to the facts. And the facts are we've had a doubling of obesity in just a very short period of time. We have an explosion of diabetes and high blood pressure and bad cholesterol, back problems. Target those conditions and target those behaviors. We can make a big dent in terms of what people pay for the cost of their health insurance premiums.
Now, you helped as well with the Clinton administration during that failed attempt at health care. And we were talking here before we came on, and I was asking what are the chances are. Does this seem like the same kind of debate, and the health care reform is going to get killed? And you said, well, we got a lot further than we did then with the Clinton health care.
Well, I remained very, very optimistic. 16 years ago, there was nothing reported out of any committee in Congress. Today, we have proposals out of the Senate and a couple of out of the House that are real substantive changes in our healthcare system. They'd be major improvements compared to the status quo. So I think with the president getting more involved, the Congress coming back this week, I'm optimistic that we're going to pass something very substantial.
So that's a huge step right there, just to have those bills. Like you said, in the Clinton era, there was no bill got anywhere. Tell us as well, though, as a doctor here, does it drive you nuts to see how the politics comes into it? And maybe a lot of people, I mean, I'm sure most people haven't sat down and read through 3-4 different bills that are 1,000 pages plus, but people are getting their information from sound bites, politicians screaming back and forth. And as a doctor, do you see that? Now, I mean, you have the patient's interest at heart. So when you see that, is that frustrating that maybe the real message is getting lost in there in a political back and forth?
Oh, it is frustrating because certainly the worst thing we can do is to do nothing. So the status quo is the worst option on the table. Premiums are going to double in the next 5 to 10 years. We're going to have more and more people that don't have health insurance coverage. So doing nothing is not an option. No bill is going to be perfect. And I think the idea is to start to make improvements in terms of getting health care more affordable, moving towards universal coverage. And if we don't get it exactly right the first time, which I know we won't, we'll come back and do it over and over again. But we got to get on the right path. We've got to find ways to make health care less expensive for families and businesses out there. We've got to find a way in terms of our government programs to make them more efficient and improve the quality of care. We can do this, but we have to have everybody on board so that everybody is not going to get their first choice, and we're hoping that everybody's second choice is not the status quo.
The last thing here, how helpful will it be, or what would be helpful to hear from the president coming up on Wednesday night? There's talk now that maybe the administration is considering putting out its own plan from the White House. Is that what is needed right now? One plan backed by one guy, and then we go from there.
I think the president does have to step up and take ownership of the issue right now. This is a critical time in this debate. I think there's a lot of ambiguities in terms of some of these major issues about the public option, about how big of a package is this going to be in terms of the size of it, how fast we're going to control healthcare spending. He can come in and resolve a lot of those big picture issues and hopefully build a bipartisan approach to doing this.
Well, Dr. Kenneth Thorpe, you work here at Emory. You're right here in town with us, and we know what days you teach, so I think we're going to tap into you and have you over here more often. But it's good to have you here. Thanks so much for coming by.
Thanks for having me. Appreciate it.
All right, Brooke, over to you.